We started Seleni in order to destigmatize mental health. Getting pregnant, having a baby, not having a baby, stillbirth, miscarriage, infertility, they're crisis points in women's lives.
It's natural and wonderful, and I assumed it would be an easy road. I assumed it would be cut and dry, and it just wasn't.
The crisis point then becomes when the reality is different from the expectation.
10 to 20% of women experience postpartum depression, which when you actually go through the numbers translates to approximately 900,000 patients a year.
Their children are more likely to have learning disabilities by the time they're in school, to suffer from depression later on in life, and they're more prone to violence.
There is a stigma attached to it, and it's not something that you feel comfortable reaching out to friends and family about.
Medical care has focused on treating various organic disorders, and there hasn't always been a recognition that mental health is another part, just as important.
But it's terrible to ask somebody how they're feeling and then not have anywhere to send them. You identify a problem and then you can't fix it. That's almost worse than pretending the problem isn't there.
I felt desperate and alone, I would say, really alone.
Our ethos is really, when a mother's supported, she's better able to support her family, and she's better able to care for her children and the people around her. Creating a beautiful environment, a place where people want to come to, where people want to open up. Those first couple of barriers are dealt with, and then the real work can happen.
The need is for accurate information about the mental health issues women face in their reproductive years, the availability of help for those issues, and how to access it. We are the gap between the experience of having a hard time and getting to the mental health professionals and the support you need.
Seleni's made a difference by really changing the conversation, by making so many services available to women across the spectrum, the economic spectrum who need them.
I think Seleni says, you know, we're here for you where you are, we'll meet you where you're at. And the idea is that not everyone is at the same level, not everyone is ready for the same level of intervention.
What we hear about so many times in Seleni is people just being so grateful that it exists. So its existence is a source of strength for people that are suffering.
When I came to Seleni, it was the first time I'd been listened to. That's why I burst into tears, was because I finally felt heard.
You can change a mother's life, you change a child's life. It's that simple.